The Silverstein Microwick for treatment of inner ear disease is manufactured by Microwick. In order to place medication in the inner ear, we use a Microwick, which is 1 by 9 millimeters in size and made of polyvinyl acetate. The wick is inserted through a vent tube placed in the eardrum over the round window niche, and the wick is inserted into the round window niche. The round window is located at approximately 113 degrees from the umbo of the malleus at about 3.4 millimeters distance. It can be seen as a dark spot behind a normal eardrum. This is a picture of our small operating room, the ESC Sharpland laser, the microscope, and the small instruments. The instruments that we use are a suction, a sickle knife, a cup forceps, and a speculum. We usually use a speculum holder. I'm now injecting 1% xylocaine and adrenaline, which has been buffered with sodium bicarbonate. 1 cc of bicarbonate to 9 cc's of xylocaine will eliminate the stinging sensation produced by the injection. We have found this a very successful and great method to anesthetize the ear with minimal discomfort to the patient. I begin the injection in the incisura to inject the outside of the ear canal with the xylocaine and then go inside. Now we see the Sharpland laser and the laser tympanostomy made. The Richards endoscope 1.7 millimeters is being inserted with the Olympus camera that's attached. This is attached to the Sony TV and Sony recorder. We hold the instrument with 2 hands, balancing them on the speculum holder to keep the endoscope steady. Here you can see the round window is widely patent. You can see the stapes and the incus. No adhesions are seen in this case. And we will be able to insert the Microwick directly into the round window niche. Here you can see the thin, transparent, semi-permeable round window membrane. This is the vent tube, which is 1.4 millimeters in diameter. It has a 1 millimeter flange, and the flange has been removed on one side so that the tube can be placed close to the external canal. We grab the tube with a cup forceps on the tab and then insert the tube either through an incision in the eardrum or through a laser tympanostomy. Here you can see the round window very nicely through the tube. This is the wick. Now the wick is grabbed with a cup forceps and is inserted directly through the vent tube into the round window niche. After this, we will reconstitute and hydrate the wick with medication. You can see the solution immediately traverse through the wick into the middle ear. Here you can see a temporal bone specimen which shows the wick in the round window niche and what happens when we add solution. You can see how the round window niche is filled with fluid and how the medication will then go into the inner ear. Here we're removing the wick with a small pick that removes the tube and wick in one piece. It's important not to try to pull the wick through the tube since it may break off. This demonstrates using the Microwick using a myringotomy. We're making a myringotomy opening over the round window niche. Again, it's approximately 113 degrees from the angle from the umbo of the malleus, and approximately 3.4 millimeters from the umbo. Here you can see a lot of adhesions over the round window. We take a small pick, and you can use the microscope to remove these adhesions. The adhesions are usually far from where the round window membrane is, and there's little danger of damaging the round window membrane while removing the adhesions. Here you can see the endoscopic picture of the round window membrane fully open and cleaned. The membranes have been removed. This is a still picture showing the round window through the vent tube. In the third case, we'll demonstrate removing adhesions again, and using the laser to make the tympanostomy. Here you can see the adhesions down on the round window niche. We'll see that a little closer. Here you can see the membranes very nicely, and you can see that they're far away from the round window membrane. We see these membranes in about 20% of the cases. The round window niche has been cleared of membranes, and you can see the round window membrane looks open. Patients place 3 drops of medication in the ear 3 times a day for several weeks, depending upon the response. The drugs presently used are dilute solutions of gentamicin, 5 to 10 milligrams per cc for Meniere's disease, and dexamethasone, 24 milligrams per cc for sudden deafness and autoimmune inner ear disease. The tube and Microwick can remain in place for up to 4 weeks and then are removed in 1 unit. 85% of patients with Meniere's disease are cured of their vertigo attacks, with preservation of hearing in over 90%. Thank you.